Welcome to Coffee Chat number 5, where we're going to go over the differences between assisted living and in-home care. Today I am rocking out one of my favorite mugs. I got this at a Secret Santa like 15 years ago from my friend Molly, and I am drinking a delightful Taylor's lemon and orange tea today, so I'm shaking it up from my usual coffee. So let's jump right into looking at 7 kind of essential areas that you're going to want to think about when you're comparing assisted living to in-home care. There is no perfect decision. There is no one decision. This is based off of you, your care needs, your goals, your financial situation, and your state-specific funds that are available. So never feel like there's only one way that you can go. The first of the 7 things is space. Obviously, square footage wise, you have as much as your house is if you do in-home care, and you can choose to move, get to an in-law suite, get an outdoor kind of shed. They had like these granny pods, they're called, that are really cool now. And so your square footage is kind of set. You do want to make sure that you have a first floor bathroom or ability to go to the bathroom on the first floor, and a first floor bedroom, especially as you age. You don't know how your care needs are going to change, so plan now for home modifications if you need to. For an assisted living facility, they're all on one floor. There will be an elevator if you live on a different floor besides the ground level. And your square footage typically ranges between 250 square feet to 600 square feet. You have single occupancy, double occupancy, and multi-suite options. So that's first consideration is space. Second consideration is medications. Medication compliance is absolutely huge. The ability to make sure that everything's organized, taken at the right day, at the right time, that you have someone to advocate for you with your physician if necessary. So in-home care, a skilled home health agency license can do home medication compliance and administration. And you're typically looking at a monthly package or fee, and then if things specifically need administered, then an hourly rate. For assisted living, typically the amount that you pay is based off of your tier, so how many medications that you need administered, although every assisted living is a little bit different. So it's just a question to ask them when you go in, is what tier that you would fall into for payment. And assisted livings always have medical personnel available, so they'll be able to administer and oversee all medication administration and distribution. So after medications, we've got socialization. So this is a big deal. And this is, to me, one of the perks of living in assisted living. I could see my parents living an assisted living facility just because of the socialization. It is easy to get to activities. A lot of assisted livings have a lot of amenities and programs, different exercise things that you can do. So, and they actually have an activities department. So that's a perk, is socialization when it comes to assisted livings is easier. For home care, the focus on socialization is typically bringing people into your home or having you go out and do things. Go to your community centers, go on a bus trip, have friends come and visit. So one of the considerations is as you age, especially if you live somewhere colder, going outside safely gets more difficult. In assisted living, everything's inside, so it makes it a little more easier to get around. So if you're someone that is very extroverted, you get very lonely very quickly, you don't have a great support system, then this could be a huge part to an assisted living, would be the socialization aspect. After socialization, we have safety. So safety, this comes down to what are your care needs and then associated how much can you afford. With home care, we focus on evaluation, early detection, prevention. So you'll have a full home safety evaluation assessment, and we'll make sure that we're doing all the fall prevention activities like taping down carpets or rugs that are curled up a little bit, plenty of lighting, not going down steps when it's night. There's a lot of little things that we do to prevent falls and to make sure that we have a lot of safety things in effect. With assisted living facilities, a lot of that is mitigated because they're set up specifically for people that are aging. So either or, both can be extremely safe. You can have 24/7 care in home. You'll have 24/7 oversight at an assisted living facility. Dementia care. Deciding on care for a loved one with dementia can be really difficult. So one of the things that you want to think about in home care is one-on-one care in a familiar space, and we often use technology to assist when you can't afford 24/7 care, but that way we can be monitoring. And obviously the level of need, especially as they progress through their journey with dementia and depending on their type of dementia, we'll adjust our recommendations for care. An assisted living facility, if you're looking at that, you're going to want to look for one with actually dementia-specific care. They have units, and these are set up, they're typically 5-to-1 ratio, somewhere around there, and they're set up with experts that are trained in caring for dementia and Alzheimer's. Obviously not familiar surroundings, and but when you need that 24/7 high-level support and you can't afford 24/7 in-home care, it can be an absolutely terrific option. So besides that, cost. So understandably, cost is a big deal. And so some of the payer sources that you're going to want to look at are long-term support services. In Delaware, those are administered by AmeriHealth Caritas and Highmark Blue Cross. So elder law attorneys can help you spend down so that you can qualify for specific programs that will provide actual financial resources for long-term care programs in-home or for assisted living. VA also assists with both. Long-term care insurance policies assist with both. And then private pay assists with both. So cost-wise, if you're going out of pocket, you're looking at $20 to $30 in-home care for IADLs, $25 to $35 for ADL assist, and $50 to $130 an hour for RN or nursing level. For your assisted livings, you're typically looking at about $5,350 at the time this was recorded, according to the Genworth survey. So I would go on cost of care calculator for Genworth. They're a terrific resources for looking at average costs at different areas. Then we have care coordination. So we're big believers in an ounce of prevention is worth a pound of cure. You're gonna want a home care agency that can proactively schedule appointments, advocate, etc. Same for an assisted living facility. Either way, at a skilled home health agency, care is all overseen by an RN, and it's the same when you're at an assisted living facility. Care is always overseen by a clinical department. Here's the best part. You can do both. So you can actually have in-home care at an assisted living facility. So you don't have to decide on just one way. As your care needs change, you can use a hybrid model of what's best for you. But this was just a brief recap of some of the things to consider when you're talking about the difference between assisted living and home care. Have a wonderful day. Head over to our website for more information and resources, silverlininghomehealthcare.com.